We have a fantastic discussion lined up for today. Joe Montgomery will be starting the conversation by providing a high-level overview of ServiceNow's integrated risk management portfolio. We will then be turning it over to Edgile, one of ServiceNow's elite implementation partners, who we are pleased to have joining us today. Edgile will be walking us through 5 gems that healthcare organizations can take advantage of now that can vastly improve their risk and compliance programs. I don't want to steal Edgile's thunder, as they will be walking through these in a lot more detail. In terms of order of operations, they will be covering solutions that they provide around automated regulatory content, which is specific to healthcare, health grievances and compliance issues, conflicts of interest, a decision engine to help cloud migration initiatives within healthcare, and last but certainly not least, an evidence warehouse that healthcare providers can leverage to collect and reuse artifacts for compliance initiatives. These are all very common use cases that we hear frequently from healthcare providers. By way of introductions, I am Christy Drzezinski. I go by Drew. I am a senior advisory solution architect covering ServiceNow's risk portfolio. I am based in New York and I cover healthcare accounts for the East. Joe?
Yeah, hey, Joe Montgomery. I am also a solution architect here at ServiceNow, focusing on the risk applications, and I cover all of our healthcare accounts on the western half of the United States. So happy to be here.
Fantastic. And this is Brian Risman speaking. I'll introduce the Edgile team with me today. I'm joined with Will Matthias, one of our directors, and Jay Dial, one of our senior managers. Myself and a gentleman named David Dechter, we're the 2 partners that look after Edgile's ServiceNow risk and security practice. As Drew mentioned, we're an elite partner of ServiceNow, and we made a decision about 3 years ago to move our entire risk and compliance practice to go to market exclusively with ServiceNow. So we built a lot of great capabilities, accelerators, and solutions that we're excited to speak with you about today. So Drew and Joe, thanks very much for having us.
Thank you, guys.
Okay, so let's go ahead. We'll just do a real quick level set on the integrated risk solution set here at ServiceNow, which is really the foundation for everything that we'll be covering today. So we do have a full integrated risk management suite of solutions that consists of policy and compliance management, risk, audit. We do have a full application around vendor risk management, managing third parties, the assessment process around that. Business continuity, disaster recovery, really a full business resiliency, operational resiliency program. And the newest member of the family is our privacy risk management application. So the family does continue to grow as we identify needs. And this is all, of course, built on the ServiceNow platform. So we can take advantage of things like Flow Designer, the mobile application, service portals, all of those favorites that the platform allows us to do from a usability perspective are all built into the IRM applications, as well as we can take advantage of those. And on top of that, all of the data that we might have on the platform. So whether that be CMDB data, data that we have from other workflows within the platform, ITSM, ITOM, CSM, all of that can be leveraged to really enhance your IRM program by performing these functionalities and workflows on within IRM. So we've come a long way in the last 5 years. The risk management application within ServiceNow, this slide looked quite a bit different a few years ago. So this is just a good representation of how much feature functionality we're releasing with every family release. And this is just a testament to how much value we can bring to our customers. So the investment that we put into the applications is just you know, seeing how much value we can bring to our customers who are implementing IRM. And if you look to the far right, this is our Rome release, which just came out earlier this month. Some of the kind of highlights are, you know, we've totally reimagined the user experience by releasing our persona-based workspaces. We've released an entirely new privacy management application, which I mentioned already. So not just enhancements to existing applications and solutions, but really rolling out entirely new applications as we invest and as we enhance the IRM suite of applications. So a lot of good stuff coming, and a lot of good things that we've delivered over the last few years. And all of that rich innovation and all of that really focus on product development is now being recognized within the market. So really, regardless of which analyst report you look at, we're being recognized as a leader. And it really is just a testament to the amount of investment and innovation that our product is releasing, and the amount of value that our customers can get out of implementing IRM on the ServiceNow platform. So last thing before we move on, and all of that being said, within healthcare especially, there are so many different ways that our customers can leverage the IRM applications. And so we have our great partners, and honestly our good friends Edgile, who have a ton of experience with implementing both your traditional integrated risk management use cases, as well as some of these more kind of unique to healthcare use cases that can really extend some of the IRM capabilities. And that's ultimately what we're going to be focusing on and what we want to showcase today. So we're super happy to have Edgile join us. And at this point, I will hand it off to Brian.
Thanks, Joe. That was a great background, and very much looking forward to double clicking in a bit more detail about some of the healthcare specific use cases. Arguably a lot of our clients are healthcare providers as well as healthcare payers, who all, as we know, have specific obligations, if you will, based on their industry, that we're able to leverage some of the great ServiceNow IRM capabilities to bring to life. So we're going to go through the 5 vignettes. We're calling them the 5 gems, if you will, that you would be able to take advantage of leveraging ServiceNow's capabilities and some of the solutions that we built. We're going to jump into the first one here. And what we're going to do is do a bit of back and forth between a small overview of what it is. And then we're going to have Jay and Will actually jump into the system live and bring that to life so that you can see what it looks like there. So we're going to keep these, 4, 5, 6 minutes each, and we'll get through the 5 of these here. As we go through that, please feel free to ask us any questions. There's a Q&A functionality, as Drew mentioned before, that you can take advantage of. And we'd love to hear your questions, and we save some time at the end to go through those questions. So the first one we have here is around what we call automated regulatory compliance content. Edgile calls that ARC. And really when we have conversations with our clients, we really talk about there really being 3 things you need to think about in order to go stand up your GRC and IRM program. The first decision is about what technology you're going to use. Arguably in our world, that's, hopefully ServiceNow. That's where we've tuned our business. The next is the implementation partner decision. That would be hopefully potentially Edgile or other partners that you have trusted in your environment that you work with. And really the third decision point that you have there is what content are you going to use in order to go build your program. So what we've done with Edgile's automated regulatory compliance content is that we've certified over 20 content packages on the ServiceNow store. Many of those are healthcare specific packages where we've taken all of the laws, regulations, and frameworks, think of those as authority documents or authoritative sources. We've harmonized those together and built a regulatory requirements framework full of control objectives, risk statements, risk ratings, that tick and tie back to the verbatim citations in the sources, as well as provided those authority documents as well. Currently in our library, there's nearly 600 sources that we're monitoring both with internal and external counsel and providing updates on a quarterly basis. As you move to the next slide, just to bring this to life, a little bit more, you'll see some example of some sources here like NIST and HIPAA, ISO, PCI, et cetera. All of those mandates, as you're aware, we're talking about something related to password requirements. They're also talking about encryption. They're talking about attestation and certification of accounts. There's a lot of overlap, if you will, between a lot of what those regulations and mandates are saying. So what we've done here is we've harmonized those, as I mentioned. And in this example here around integrated password requirements, we've taken exactly what's coming verbatim from those sources, harmonized those into a risk statement and a corresponding control objective. Once we've done that, we're then able to apply that out to the operating environment. Think of all the applications now that you need to control with that password standard control. You're able to make that mapping of those controls and risk statements out to your operating environment That's done through the entity types and entities in ServiceNow. So Jay is going to look to bring this to life for everyone here. We're going to show you the mandates, highlight some examples of the pressing healthcare laws and regulations and how we get those into ServiceNow. We'll show you the control objectives and how we do the harmonization of those, the linkage to citations. And then we'll talk about the integrated risk side of that by show you how we can do risk ratings with the roll up and drill down reporting. So with that, Jay, I'm going to turn it over to you and we'll get into the system.
Perfect. Thanks, Brian. So jumping into the system here, we're going to quickly start with a dashboard. This dashboard here is showing us our compliance as an organization to those key laws, regulations, and best practices Brian mentioned. So in our example, we're looking at the HIPAA audit protocol. We're looking at 45 CFR 164, also known as HIPAA. We've got NIST CSF and others. So we're able to quickly see at a macro level, how are we doing as an organization to the key drivers to our compliance program. It allows us to quickly see, in the green, from a HIPAA audit protocol perspective, we're at 72% of those controls have been implemented or deemed to be operating effectively. We have something about 8%, 9% here that is not implemented. And we're even keeping track of what we would call a partially implemented, those that we're covering off a portion of the obligation, but there's still work to be done as an organization. And this is great because it starts to give us that very targeted view of the world where we're using a content offering like Edgile's automated regulatory compliance to drive an assess once, test once, satisfy many model, whereby we're looking at all those kind of harmonized requirements for things like passwords and user access reviews and the like. But then we're able to kind of tease that out and show for a particular regulation, how are we doing as an organization? And this is great. We can see this at a macro level. We can also take this to one particular application or process or function in the system and really filter this down and really start to see, how are we doing at that macro level or micro level, excuse me. This all starts with an authority document, ServiceNow's term for all those different laws, regulations, and best practices. What we have in our instance today is an example of our healthcare provider with research content pack. So that includes all of your NIST and FSMA related requirements for those federal research arms of your provider business. This includes all of the breach notification and state privacy laws, in addition to all of the HIPAA and related content. So we've got nearly 300 in our example today. We're going to dive into one authority document. We'll just double click down on HIPAA for our example today. I'll give this a second to pull up. Here we go. And we're looking at one authority document as part of Edgile's content. We're providing a description, a URL to the verbatim source, but more importantly, we've taken each of these authority documents and decomposed them into a series of citations. So in our example here, we have 150 citations for HIPAA, and these citations represent the different sentences, paragraphs, and sections of the authority document. When we look at a citation, we're providing the verbatim language directly out of the source. We are not editorializing it or modifying it any way. All we're doing is breaking it down into these bite-sized topical chunks. And we in turn map these citations to a control objective. So this one here is talking about periodically reviewing access. We've mapped that to our control objective titled attestation and certification of accounts. When we get to the control objective, this is where it all really starts to come together and we can drive that assess once, test once, satisfy many model. So for this control objective for user access reviews, we've got linkages back to HIPAA, back to our internal policies and standards, as well as Cloud Security Alliance, some FDA requirements. And if we were to scroll down a little further here, we get into ISO, HIPAA audit, and a little further down is some of the NIST guidance. So it helps us determine, for a particular topic like user access reviews, what do we need to be doing as an organization based on all of our regulatory drivers. So we can tell the field that very concise Reader's Digest version, if you will, version of all those different regulations so they understand what controls they need to be implementing at the end of the day. We recognize that risk is only one side of the coin when you think of integrated risk and compliance, the other aspect being the ability to look at it from a risk perspective. So for every control objective, we have a corresponding risk statement. And this begins to form the basis of a risk register for information and technology risk. As part of our content, we're providing this description to help you understand the potential risks that face your organization, as well as default inherent impact and likelihood values based on what we've seen in industry. We encourage our clients to tailor those to their business, as well as consider what their residual risk is, kind of at a macro level, so that they can start to build a comprehensive view of the world for risk management. The last piece to touch on before we continue would be the ability to roll all of this information up. So we're able to take those risk statements and use some taxonomy to start to look at how are we doing in topical areas. So we're looking at 4 different risk topics as it relates to identity and access management, and we're able to quickly see inherent and residual risk, both qualitatively and quantitatively, and start to understand where investments are paying off and where there's work to be done. The nice thing is if there's any questions from business leaders and the different stakeholders, we can actually trace these risks directly back to those different laws, regulations, and best practices, so they can understand why we need to be doing this and the potential threats to our business. And with that, Brian, I will turn it back over to you to continue on to the next vignette.
Fantastic. Thanks, Jay. Now, we've even seen versions of this report actually make their way to the boardroom to have risk-based conversations with the board, with CISOs and things like that. So I think it's a really great way to all align to the North Star and what the laws, regulations, and frameworks are saying, have the ability to drill down leveraging ServiceNow's capabilities. Perfect. So 1 down, 4 to go. Next, what we have here is our solution related to health grievances and compliance issues management. So with that, we'll, as you all are all aware, healthcare providers and extent payers, all are mandated to provide mechanisms for internal and external stakeholder groups, I think patients as well as employees, being able to have the ability to, request and have a grievance be made. And with that, we need the ability to have both internal and external reporting capabilities and intake capabilities to manage a variety of different use cases. So what Edgile has done is that we've built a solution on the ServiceNow store called the Grievances and Compliance Issues Management application, where we've pre-built internal and external facing portals, allowing you to have intake forms and have workflow to manage those processes. You'll see some examples here on the screen here, for example, both from an internal and external facing perspective, things like claims and billing, clinical care and privacy, hospital and facilities management, and then more from an internal facing perspective, data protection, ethics violations, fraud, waste, and abuse. And what we've done is that we provided some initial forms, if you will, pre-built grievance forms and workflows. There's, I believe, 7 that come with their application. We're going to bring that to life, for you in a moment here. And then there's the ability to tailor that solution to add on additional use cases, forms, et cetera, based on how you set up your grievances and compliance management process. So we're going to bring to life in the system here. If we go to the next slide, we're going to show you both the external and internal portals here. An example of a patient accessible portal to report grievances. Then we'll have the ability to show you how that would look internally for the workforce to being able to, make and report on grievances. And then we'll show you an example of what a data breach intake form would look like. So with that, I'm going to turn it over to Will Matthias, who's going to take us into the system and bring this to life for you. Thanks, Will.
Thanks, Brian. I'm going to switch over to my screen. And hopefully you're seeing the grievance management portal. So this is one of the 3 intake portals that we pre-configure. These can be adjusted, but out of the box, they become ready to take a lot of different types of intakes. This portal is special in that it is public facing. So this can be accessible to people who don't have ServiceNow credentials. It gives them an ability to provide that data, and then your team within ServiceNow can act on it. As you see there's a number of these different categories. Each of them has an intake form. I'm going to jump in and show for HIPAA privacy. If someone had a concern that they needed to voice, they could go to this portal, click on that, and then enter in their information. This information includes, who the patient was, and then information on what the description of the issue is. By providing things like the patient email, you can get back in contact with this person to follow up. But as far as initializing it and getting the intake rolling, they nearly have to go to that portal, fill that in. Because it's public, there's mechanisms to prevent abuse. So the CAPTCHA, make sure that it's not going to be sent from robots. There are two other portals. One is internal, similar to that for the grievance, but a third one are for compliance issues. This portal could be made accessible to a variety of people by default. It's meant for your system users of ServiceNow. They can go in and they can fill out each of these. Each of these intake forms is got specific information for that type of violation. And then when the data is recorded in your system, it'll know which one of these it came from, helps you sort and manage all that. I want to give an example here of data loss. So here we can, specify how many records were affected. This example, I'm saying that someone lost a laptop. It had some data in it. I can specify what kind of data. So I picked those three. It didn't happen to have any PHI, but it had some PII data. I explain a little bit about that, and then I can click submit. Once this data has been gathered, it's turned over to the risk and compliance team to respond and deal with that. And one of the tools we've provided is a dashboard. This would help you track grievance issues, what categories they're coming in from, maybe what compliance issues are coming in. The ServiceNow dashboards are all interactive, so I could drill in and I could get into the details of that specific group and get more information that way. We're also highlighting which issues have been marked as critical or high priority, and what issues based on your deadline of responding within 60 days, are maybe past due and something needs to be done. So this is what an issue would look like when you got into an individual one. So as it was sent in, it would come into the new stage, and all this information that had been provided on that portal would be brought in. You then can go through a process familiar to the issue management and other places in ServiceNow where you'd analyze it. You could assign it to someone to resolve. They could come back with a response on how they're going to remediate it. And then you can go through and eventually close that. All of those normal processes are available, and they can be connected in with other issues so that if you have a common set come in, they can be tracked that way. And with these dates, you're able to manage when this might actually be completed and when was it created and needed to start. So that's the grievance and compliance application. Involves portals where intakes can be brought in, and then the individual issues that are created can be dealt with inside of ServiceNow.
No, that was great, Will. Thank you. And I think, one thing I wanted to note as we were going through that is a lot of those forms and those dashboards, that's all configurable in ServiceNow. So there's additional information you wanted to capture on those intake forms, or there was a different type of grievance you wanted to specifically track or compliance issue, that could all be configured here as well. So these were just some examples. I mentioned, I think there's 7 use cases and forms that ship out of the box, and then that integrates in nicely, with ServiceNow's IRM capabilities. Perfect. Well, with that, we're going to jump into our third gem and use case here, and this is one around conflicts of interest. Jay, Will, the team, and myself, we get asked often about how can we leverage ServiceNow's IRM capabilities to support the conflicts of interest process. And there's many different ways that we're going to bring to life in a moment here on how that can be done. Really the first piece here really is around the setup and the management and establishing your conflicts of interest program and policy. So think about the policy around conflicts of interest, leveraging ServiceNow's policy lifecycle management capabilities. There's the ability to do a annual attestation through a policy acknowledgement campaign where you can have your workforce acknowledge and attest that they've read and understood the conflicts of interest policy. So that's really what we're talking about first on the governance side on the left-hand side here. And then there's the ability to also leverage ServiceNow for what we'll kind of broadly call the continuous monitoring piece there, about being able to do, conflicts of interest assessments, if you will, or being able to do reporting on possible conflicts of interest, being able to do investigations and the self-reporting and some of those capabilities. So there's a lot of different ways to manage the healthcare specific conflicts of interest processes, as well as do that continuous monitoring piece. So we built some solutions and capabilities as well, leveraging the core ServiceNow IRM capability. We're going to have Jay bring that to life. So if we kindly go to the next slide, you'll see we're going to show you what an acknowledgement looked like, where you'll see COI acknowledgement from workforce members. We'll then show you what it looks like to do an assessment to review the potential conflicts and respond after an investigation. And then we also want to make sure that we're empowering our workforce in a self-service capability and being able to do the self-reporting functionality as it relates to conflict of interest matters. So with that, we're going to bring that to life and we'll get back into the system with Jay.
Thanks, Brian. So jumping back into the system, we will start by talking about how we have the ability to manage our conflict of interest policy to begin with. So as part of ServiceNow's IRM solution, there's the ability to do policy governance and lifecycle management. So we can have our internal conflict of interest policy in the system. We can run our review and approval cycles, making sure that it's regularly approved and published to the organization. Once it's been published out, we can then look to do these different acknowledgement campaigns. This is sending out a notification to the different members of the organization, asking that they go in and read our conflict of interest policy and that they either accept it, maybe we allow them to decline or to request an exception. And we can define who we want to send this to within the organization. In our example here, we are sending it to all employees, but we do have the ability to scope that to certain facilities or certain types of users, maybe those who are not necessarily the cafeteria workers, but rather the physicians, the folks who may be more likely to have a conflict of interest. We can scope that appropriately to make sure that we're sending out this acknowledgement request to the right part of the organization. So I've gone ahead and created this acknowledgement campaign and I've sent it to all of our employees. They would get an email notification asking them to go into the system to read our ACME conflict of interest policy. It's presented here in a read-only format. And at the bottom of this, they're given 3 options. We have the ability to accept this conflict of interest policy. We can request an exception, or we could decline this particular conflict of interest policy. We have the option to maybe disallow the decline option, and there are 2 choices being presented to the business are to accept our conflict of interest policy or to request an exception. But in either case, the way we've set this up is if they are to request an exception or to decline this, it will create a survey and send it to the member of the business. And it also will notify our compliance team that there's a potential conflict of interest with this user. This survey is intended to help dig into the details. They've said that they're unable to accept our conflict of interest policy, and well, we're going to want a little more detail about that. So we have the ability to send an assessment. This one here is one that we've pulled together for the purposes of our discussion today, but we could align this to the different types of conflicts of interest that your organization is concerned with. And so this is asking them a series of questions of if they're being involved in institutional purchasing decisions, if they accepted a gift from a vendor. And for each of these, if they were to say yes, we ask them to provide more detail. And once they complete this assessment, it would let our compliance team know that not only do we suspect a conflict of interest with this particular individual, but here is their assessment. Here's that additional information that they've provided. These assessments can also be sent out to all users to begin with, if we'd rather take that approach where we're asking very explicitly these different types of conflicts of interest. And if anyone were to say yes, that they do have a conflict of interest, triggering that process as well. So this is how we can go out and ask the business if they have a conflict of interest, but we also want to give them the ability to come in and report that. So we can give them the ability through the service catalog, the ability to go into the system and search for conflict of interest and allow them to report this. In this example, I'm reporting that I suspect that Bob has a conflict of interest. He said he took a trip to Hawaii and it was paid for by a vendor. To my knowledge, this is a violation of the conflict of interest policy. And this would kick off that same review process, notifying compliance team, giving them the ability to go and investigate whether Bob had a conflict of interest or violated the policy or not. The last piece I'll mention here is we do recognize the data sensitivity around these. So much like those compliance issues and grievances that Will showed earlier, these would be segregated through stricter access control. So only the appropriate members of your compliance team have access to review these in the first place, so that it's not necessarily anyone using the IRM solution would be able to see these. The last piece I want to touch on before we jump back to our next vignette is this policy acknowledgement dashboard, just an example of the sort of reporting that we're able to do, keeping track of those different acknowledgement campaigns, the different statuses, keeping track of those past due acknowledgements, and seeing those policy exceptions that have been required, give us a very kind of targeted view of the world, making sure that we're keeping track of the different policy aspects. And with that, I will hand it back to Brian to jump into our next use case.
Sounds great. Thanks, Jay. That was great. All right, we got 2 more to go. Next, we're going to jump into our decision engine. I'm going to spend a minute or two really unpacking what this is here. Ultimately, I think what we're seeing is a lot of organizations, especially healthcare providers, are starting to lean in a bit more to cloud migrations of putting their data into the cloud, leveraging SaaS capabilities and things like that. And ultimately, what you need is that you need to get the business and a variety of stakeholders on board with the sensitivity and criticality of the data that is being managed in a cloud environment. So as you'll see on the next slide here, you'll see a variety of different stakeholder groups that ultimately, we would theoretically need to get their fingers on, the data and decisioning of being able to move that data. And I think Jay used an example of, cafeteria, for example, like if we're moving the cafeteria menu system, program or application to the cloud, we probably don't care about it as much as, if we're moving, EPHI into the cloud. We're gonna have different controls and considerations, and restrictions on how we're securing that environment, than the former one. So, what we found is that we've been involved in a lot of projects where, dozens of stakeholder groups, I think we're seeing 8 here on the screen, want to have their view or their opinion about, from a privacy perspective, what does that mean for that data or that application? What does it mean from an ethics and compliance perspective, or a business continuity perspective, or a supply chain perspective? Think about the supply chain for medical products and supplies, for example. So you need to have an opportunity in a way to get everyone's inputs and fingers, proactively before you're moving that data into the cloud. Because what we see happen sometimes is, data might get moved before you're asking for those inputs, and there's a lot of rework that needs to be done. So, we see this as a way to accelerate the time to value by being able to get the decisioning and the inputs from a variety of stakeholder groups for net new applications being built or onboarded, or the moving from a on-premise data center, into a cloud-enabled environment. you look at the next slide where we'll show you really what a concept of operations looks like for the decision engine. So as an example here, so with step one, there could be a new application or a cloud workload that's been identified. You identify the application owner. They're then going to the portal, and they are going to complete a questionnaire. They're going to fill out a form about what type of data this is. So think about that as the intake process, if you will. And then the decisioning behind that will say, leveraging, because this has EPHI in it and it's high availability, high sensitivity, this then has the following classification ratings. Those classification ratings can actually be written to other parts of the ServiceNow platform, such as application portfolio management, such as the CMDB. What it also can do is do a series of fulfillment tasks. So say, for example, you're bringing on a new SaaS application, for example, that's the first time that you've been doing business with them. You might want to go kick off a vendor risk management assessment of that vendor who's hosting your data to go understand what controls they're going to have in place, maybe look for their SOC 2 and things like that. So really the ability to do decisioning, kick off follow-on tasks, and write to the rest of the platform, as well as give blueprints and propose configurations for how you want to secure that environment. Ultimately, you'll see here, on number 5, the run state, if you will, what's really neat is the ability to then also leverage ServiceNow for the continuous monitoring of those controls and configurations, leveraging indicators. So as you know, you might say that, well, these configurations might need to be in my Azure or AWS environment to secure that data. Well, we should want to monitor those configurations to make sure that nothing's changed, or if the laws and regulations have changed, we need to know what are the impacted configurations to make sure that they continue to remain hardened so that we remain in compliant with the various mandates and policies. So really closed loop process here for decisioning, multiple stakeholder groups, and being able to do follow-on tasks and reporting. So we're gonna have Jay bring this to life, because I know there's a lot there that we unpacked there. We're going to start with the intake process and show you what an intake form and questionnaire looks like. We're going to show you how we can go through a ratings process for consistent ratings from a confidentiality, availability, and privacy perspective. And then we're going to get into the consultation and fulfillment tasks. So Will is going to take us through the decision engine demo here. And with that, I'll turn it over to him. Thanks, Will.
Thanks, Brian. I'll bring up my screen here. So we're going to start things off with the initial intake, which is simply a service catalog item. So this can be available to your users in a variety of ways. We've kept this pretty simple, but this could have a lot more questions. Its main intention is just to get the ball rolling. One of the things to understand about the decision engine is it does have a lot of configuration options. In this particular example, we're showing it for examining new vendors or applications and trying to get a sense of what risks they might have for the organization. So those new assets, bringing them in. And as Brian mentioned, what we want to do is get all these different stakeholders to be able to get the inputs that they want. This is a benefit to your end user because they're not being asked the same question multiple times by multiple stakeholders. They can go to one place, answer the questions, and basically provide the information that each of those different departments in your organization are concerned with. So before we get to the point where we can have it working, we would work with you to come up with the questions that would be needed, the automated triggers that determine what tasks might come out or what scoring might be needed for the different data classifications. We have starting libraries for all of that. We also can work with you and take whatever your organization has. So there's a lot of flexibility. But to start with, I would come in and say, I've got a new SaaS application, I called it MedBill, and I submitted it. Once I've submitted that, I'm going to be sent to an assessment that's going to ask me a series of questions. So these questions are all configurable. all dependent on what your organization wants, and really makes it much easier for the end user to answer those questions, and also for your different stakeholders to make sure that nothing's getting missed. These questions, they're using the ServiceNow assessment engine. So there's a lot of flexibility where depending on how you answer things, different questions could be hidden or shown. And there's a lot of different types of questions, different drop downs, yes, no's, multiple choice. And we've got this divided up into different pages. So these different pages sort of help focus the user on these different areas. So they might be able to answer what kind of data that this information system or vendor is going to be doing. And that helps also, determine the availability, confidentiality, integrity. All of these questions can be customized for your system and can go into a variety of different topics. When the respondent submits this, they may not have answered everything. They may have had some hard decisions and didn't know exactly how they want to do it. One of the things that our system does is help generate what we call consultation tasks. So before they answer yes to something that's going to cause a huge investment or a long analysis, they're given a connection to that expert team to have a short phone call and basically talk over their project, their new application, help that team be aware of it, and help ensure that they're answering the questions correctly. So there may be multiple rounds where they can go through and answer these questions, and there's a guidance helping them to get through all of that. Ultimately, based on scoring that you would configure, we can provide classifications, and we can have multiple different scoring buckets, if you will, multiple different categorizations of these, and they can be very helpful in identifying what kind of system is being brought in. Now, one of the other exciting things is that in addition to these consultation tasks, we can have fulfillment tasks. This is very powerful because there's many times that a system's brought in, assessments made, go-aheads given, and yet maybe there's a question about, did we ever actually finish all of these things? And because it's really hard to have one place that brings all these together, that question can be difficult to answer. By having all this tied together, all those different stakeholders, we're actually able to show people, based on our policies and based on how the questions are answered, this system needs these things. And these then are sent to the groups that would perform them. So these are not necessarily the quick consultation task. This is the long, maybe multiple week fulfillment task. And so vendor risk would need to come in and do the assessment. And this isn't the assessment itself. This is tied in saying, is that assessment completed? And so you can provide some information on what you're expecting, a very short description, and then they can provide their comments, and they can provide evidence that it's been completed and mark it as closed. This is a standalone application that wouldn't necessarily need to tie in to other pieces, but there's many opportunities for it to tie in to things like the application portfolio, vendor risk, even your project management module, where people are putting in their projects and IDs. This can be used in tangent with that. One of the last things I'll show is there are different pages available. this is sort of a work queue where someone can come and they can see all their different requests. You know, I have a couple that are open. There's an approval process. I've got a couple that are waiting for approval. And then these are the tasks that were assigned to me. So if I'm in that vendor team, I may not have any classifications, but I could come in and I could see that I've got 3 different applications that are being onboarded, and my team, the vendor team, needs to do those assessments, and we can divvy those up, and those can be shared, but then there's still a person assigned to it so that we know who's running it. That's very helpful in workload balancing as well. So Brian, that's
fantastic. Will, that was great. Yeah, and we're seeing a lot of power of being able to leverage the decision engine to do a lot of these fulfillment tasks, take up other processes on the ServiceNow platform, you know, as well as get stakeholders aligned, you know, and talking the same language. So that was great, and look forward to being able to share more about that, you know, with customers who are interested. All right, the last thing, I know we've got a few minutes left. I want to quickly touch on the evidence warehouse and save a few minutes for Q&A. I know there's a few things that are coming in there. And ultimately what we wanted to show as our last one is our evidence warehouse solution. And really this is like the holy grail, you know, utopia. And I've been doing this for quite a bit. And, you know, one of the things is this kind of phrase that's been out there for a while that, you know, people are trying to achieve is the ability to perform something once, test something once, and satisfy, you know, multiple requirements. And I'm sure, you know, perhaps you have heard and have been in the shoes, you know, where audits come into you every day or every week asking for the same piece of evidence. And you're saying, well, I just gave that to the auditors last week. And they're like, oh, that was a different set of auditors. You know, we're a new set. You know, so how do we get efficiencies in the ability to reuse evidence for multiple purposes? So if there's a smart way to set up your control framework, if you will, and then being able to have what we built here as a series of evidence and evidence lifecycle management process with evidence boxes, ultimately with an evidence warehouse, you know, we believe we can get to a point of being a bit more proactive in how we're managing those various evidence requests, and even, you know, have the ability to have, you know, workflows and reminders being sent out to people to actually remind them to execute their controls as well. So that kind of proactive assurance from a controls performance standpoint. So what we're gonna have Jay unpack here, you know, really are 3 things. It's the evidence warehouse, how we set up these campaigns, how we built evidence boxes to get specific evidence for particular control. And then ultimately, how do we do the approval and archive process, ultimately trying to get you to the point of being able to reuse that multiple times. So with that, Jay, I'm going to turn it over to you for our last walkthrough in the system, and then we'll quickly wrap up here with Q&A.
Thanks, Brian. So we'll quickly kind of give everyone an overview of the evidence warehouse. So we're here at a dashboard, kind of giving us a status of all the different evidence boxes. So within the warehouse, a single box represents you know, one area or topic that we want to gather the different artifacts for. And each box has a life cycle applied to it. And it starts with this draft or empty state. And this is where we're defining what is this box going to be. Maybe it's going to be user access review evidence for 4th quarter. And we can specify who do we want to collect that evidence from. That could be from named individuals. We could also look to collect based on groups. Groups are particularly useful as folks move throughout the organization, making sure that we know who we would engage for this evidence in the future. Once we're done defining the box, we can send out these collection tasks. So the users who've been defined or selected will get an email notification letting them know that they need to gather some form of evidence. We'll give them instructions and tell them what we're looking for. And then once they've completed that collection, we can perform a review. This review is around making sure that that evidence is what we were looking for. If we wanted a policy or standard, did they give us that? If we're looking for screenshots, did they include the relevant elements within the screenshot in a way that we suspect will satisfy future audit engagements? As part of that review, we can either send it back to collection to get updates, or we can put it in this prepared state. Once it's in a prepared state, we now have the ability to link it to different control tests, to different issues, to different control testing engagements. And once we link it to one of those things, it will go into a supplied state. Big difference here is once it's in a supplied state, it's acting as evidence, and we no longer allow any additions or removals of files to that evidence box. We lock it down because it's now evidence in support of some assurance activities. The last piece is we can time bound these boxes. We can say that it's good through the end of the calendar year or good for the next 12 months, at which point we will archive it, keeping it for historical purposes, but we're no longer able to link it to new control tests or issues or testing engagements. As part of that archival process, we can also trigger recollection. So this works very well for kind of a proactive assurance model, whereby we ask our control owners to gather that evidence in line with performance frequencies. So if we need to review our firewall rules every 6 months, let's ask that they provide that evidence every 6 months so we can gather it and make sure that the control is being performed and that we have the necessary evidence. And we can see here at the bottom, we have a couple evidence boxes that are actually coming up for recollection here in the next 30 days. I want to quickly take a look at one evidence box. This one here is already in collection. We've said that Jay and David would be our collectors and that we would want to review this. We do have the ability to make this accessible to auditors. So if you're using the audit management solution in ServiceNow and you've granted access to the different external auditors, maybe using the external auditor role, we can determine whether or not this particular evidence box would be visible to them. So it allows us to be very targeted in what we share to those different audit groups. Down below, we can see that this will be archived at the end of the calendar year and that we will start our recollection, it's like Monday of the new year, and that we would want to recollect this on a quarterly basis. We had 2 tasks assigned, one to David, which has been previously completed, one assigned to myself, asking that I provide some evidence of the attestation campaign. And in addition to being able to collect this evidence, we can link these evidence boxes to those control objectives that we saw earlier. So this one in support of user access reviews is linked to that attestation certification of accounts control objective. We can in turn link it to each of the individual controls. This is particularly helpful for us keeping context in terms of what this box is and potentially what part of our organization it's covering. In addition to those controls, we can also link it to the different authority documents and citations. So if we're ever asked to pull together a HIPAA package or some sort of privacy package, we have all those linkages back to the different laws, regulations, and best practices that helps us locate this evidence in short order. So a lot of linkages to the various elements of the IRM program. With that, I know we have about 5 minutes remaining, so we'll throw it back over to the group for some Q&A.
Fantastic. Thanks, Jay. Well, Drew, I think we got a few questions that have come in and that we want to cover.
Yes, we certainly do. So the first question is for Edgile. And the question is, are the applications discussed today available for download on the ServiceNow store? And is there a cost associated with them?
Yep. So the solutions as it relates to the decision engine, the content, evidence warehouse, as well as the Grievances application, those are all certified, built on now applications on the ServiceNow store. There's a nominal cost for those. The real reason is that we actually are keeping these applications up to speed with the latest versions of ServiceNow. So instead of you needing to custom develop or configure this functionality and then make sure it's code compliant with all the future releases, we're doing that for you. The content apps, we're actually monitoring those content as part of a subscription service. So there are some nominal charges for those. I promise they generally don't break the bank, but we're usually, so there is a fee associated for those, and we're happy to talk about that in more detail.
All right, great, thank you. So the next question is, how frequently is the ARC content updated? And I think that you addressed this saying it was updated on a quarterly basis.
That's right. Yep. So we're doing really 2 things there, Drew. One is we are monitoring all the existing sources in the library for version changes. So, PCI DSS comes out with new versions, NIST comes out with their different revisions, HIPAA changes, et cetera. So we're monitoring the existing sources and pushing those updates quarterly. And then we're also onboarding new sources. So I think tomorrow, actually, our Q3 release comes out, and I think there's something like 27 new sources that we've identified, or actually our clients have identified that they wanted to ask us to include in the library. So we're monitoring the existing ones, we're onboarding net new ones, and then every quarter we're making updates to the ServiceNow store to allow those to be ingested.
Okay, perfect. And the last question for the Edgile team is, how many customers or healthcare customers specifically are using these applications? And do you have any references?
We do have many of those. Couple things. So I can't get them all on the call today, but we have dozens of customers, using our solutions today. We've actually have had previous webinars with healthcare customers, or those in the, I'll call it life sciences and health space, that have actually spoken on webinars. So we can share those with you as public references. And then, based after a conversation, we can get you connected to some of our customers who would be happy to have a private dialogue with you about, working with those applications and the value that it brought to the organization. So the short answer is yes, Drew, and we're very happy to make those introductions.
Okay, great. Thanks, Ryan.
Perfect. Couple of quick questions for you and Joe. One is around, what level of IRM licensing, is needed for the applications and solutions that we spoke about today?
Yeah, I can take that, Drew. So everything that we looked at today is just the only thing required from ServiceNow IRM is the IRM standard, which is our lowest package. So everything that Edgile team walked through is just built on top of that IRM packaging. So from a ServiceNow standpoint, it's just that IRM standard packaging, and then any of the store applications from Edgile on top of that.
Perfect. No, thanks, Joe. And I think we got one more question with the 2 minutes we have, and that's about more details on the new features that came out with the Rome release, which came out a few weeks back. So I know people are excited to see, what came out there. So where can people go to get more details on that, Drew?
That is a fantastic question. And with that said, we have a number of Ask the Expert sessions that are coming up in the month of October that will cover the new features from an integrated risk management perspective that are available in the Rome release. So Joe Montgomery covered some of these at a very high level, but our new innovative workspaces, a brand new privacy application, and major enhancements to our business continuity application. Lots of really fantastic information available in this Ask the Expert series. If you are unable to register or attend these live sessions, these webinars are all recorded and made available on a YouTube channel for Ask the Experts. All right.
Fantastic.
So with that said, we have 1 minute. I mean, the timing on this was absolutely fantastic. We couldn't have planned it any better. So with that said, we will wrap up this presentation. We have contact information here for anybody who has further questions for either the ServiceNow team or the Edgile team. We are absolutely more than happy to entertain those. I want to thank our audience for participating and for taking the time out of your busy schedules to attend the webinar today. And I also want to certainly thank the Edgile team, who we have a fantastic partnership with. We always work so well together. It's obvious on the webinar today. So I want to thank them for their joint efforts in putting together this webinar.
Our pleasure. Drew and Joe, thanks very much. We look forward to speaking to everyone soon.
Thanks, everyone.